guys, how are you? I hope you are doing good. I hope you had a good weekend. I am coming here with a topic that somebody asked me to speak about. It's not a common topic. The official name is Hirsutism, but what it is an overgrowth of hair in women, meaning you're growing hair where men usually grow hair, but you're a lady. So that's basically what it is. So I'll go into just the basics, and I do have notes today, so I will be looking at the notes, but that's what it is generally. Overgrowth of hair in women in places it should not be. And many people would ask, which places? The chin, the chest, neck, and upper back, or part of the belly. That's where hair usually grows. And in women, it's not supposed to grow there, but some women, because of this disorder, do have hair in those parts. What causes it? Some people, it's family background, not so common. It may bother them, it may not bother them, but most people are bothered by having hair in places where it's not supposed to be, especially in women. It's supposed to grow on a man's chest, but it's not supposed to grow on a woman's chest. Other people, it's hormonal problems that you have to be evaluated for them to find out what's causing this hair. So hormonal problems in some people, what would happen is you have high levels of the male hormone, and that's why the hair is growing in the places that it's growing. And that male hormone is androgens. Androgens, ANDROGENS. That's the male hormone that causes us women to have that hair. It happens in the hair follicles where hair grows. That's where it comes. Most common condition that leads to extra androgens in women is PCOS. If all of you have heard of a syndrome called polycystic ovarian syndrome, those people usually have hair growing those places. Hirsutism is what it is in technical language, but it's just overgrowth of hair in women. So most women with polycystic ovarian syndrome will have hair in those places. It causes irregular periods and also causes them to have a lot of weight gain, which has nothing to do with their diet. It's because of that their weight is almost uncontrollable, so almost out of reach for them to get into a comfortable weight. It's not because they're eating bad, but it's because of the polycystic ovarian syndrome. Acne, they also do get acne, even though they're not in the age of acne. It's not teenage acne, it's grown-ups who are having this acne. There are some other causes of it. These are rare. They can happen, but they are rare. Usually tumors in the ovary or adrenal glands. So this would need imaging for them to know if you have this. Those are rare, but they do happen to some people. What other symptoms should you watch for? Irregular periods, acne, obesity or weight gain, hair loss from the scalp, and sleep apnea. Those are some of the other symptoms that you should watch for. Should you see somebody? Yes, you should see somebody. These symptoms are bothersome. So it's important that you do see somebody so that they can follow you and treat you for it. You can have a blood test to measure hormones. As I said, it's a hormone, male hormone. So you can have a blood test to measure that. Pelvic ultrasound is another test that you can have where they go in and visualize the pelvic with an ultrasound. It uses sound waves. They use sound waves and they can see what's going on in there. CT or MRI, but they'll start with the minor ones before they go to a CT or MRI. So that's another test that can show. But the CT and MRI will be clear if you have the tumors. So then it will show. It's rare, but it does happen. There's always a chance in one chance in a 10,000 or something for some rare diseases to happen. So that's something that can happen. So that's something that you can also watch for. It will only be done, the CT or MRI will only be done if your testosterone levels are extremely high. That's when they'll go on it. Otherwise, the pelvic ultrasound and the blood test is substantial. It's enough for you. So you don't need to have that done. But if the testosterone levels are extremely high, then they will order that to look at the adrenal glands and just make sure it's not a tumor that's growing. People ask, is there anything I can do on my own to treat the condition? If you have excess body weight or obesity, exercise can help. It will help lower the androgen levels, because it's androgen levels that are high that are causing you to have this syndrome. So it will improve symptoms. If you lose some weight, Weight will always improve symptoms. It will improve knee pain and everything. But in this case, it will improve your symptoms. For someone who weighs maybe 200 pounds or more, it's important to at least exercise and eat right. We know the disease is kind of preventing you, but as much as is possible with you, what you can handle. Body hair, if it bothers you, just remove it. Shave, pluck it, because people do look at you weirdly because they have no clue what's going on, you know. Most of the weird looks are from ignorance. Not that they know what's going on, they just don't know what's going on. So you can shave those areas, pluck the area, wax if you can stand the wax. Some people will bleach their hair, but mainly most people will shave and wax the area. So that's the main one. How is it treated? How is hirsutism treated? Overgrowth of hair, how is it treated? Some people will get on birth control pills, and that should be able to help lower the androgen levels. That's the most common treatment, is get on birth control pills. It helps lower those androgen levels very quickly. Some people get on the medications. They are called androgens, anti-androgen medications, because it's the androgen that's high. So they are anti-androgen medications. So you can get on those. They do have examples of them. I won't give because I am a nurse practitioner, but I'm not your nurse practitioner. So if you do suspect having those symptoms, it's important that you see somebody who can start you on an anti-androgen medication to help with the symptoms, lower the effects of this androgen. And it's common, and most doctors know how to treat it. Some people, because the hair bothers them, they'll just do long hair treatments, you know, laser the hair off so they forget about it and don't have to worry about it. Laser is painful, but if you can handle it, and sometimes when you really need something, you're able to handle the pain. But laser electrolysis, which uses a tiny needle and mild electrical zap to destroy the hair roots so that they slow the growth down. That's another way you can do it. It works on small areas of the skin. So if you have a wide area, then that may not be the case for you. Another one is what I said, laser hair removal. Super painful, but super efficient too. Most people need treatment, 4 to 6 treatments to completely get rid of the hair follicle. So you'll have to go through over and over again until they can get it. And some people, it completely removes it, and other people just makes it so slow so that the hair is not growing there as often as you would want it. So it's helpful for those people who want to have laser hair removal. If you can, laser is painful. If you can handle the pain, absolutely go for it, you know. Some people say, what if I get pregnant? People with overgrowth of hair are able to get pregnant. There's nothing that prevents them from getting pregnant. If you have PCOS, overweight, losing weight can make it a lot easier for you to get pregnant compared to when you're overweight. Okay, we'll continue from there. What if I want to get pregnant? You can get pregnant. It would just be nice if you lost weight prior to getting pregnant. It makes it a lot easier for you to get pregnant, but there's nothing wrong with it. You're absolutely able to get pregnant if you have PCOS, so do not shy away from it. There are medicines that can help you out. If you are trying to get pregnant, do not get on medicine. Follow up with an obstetrician gynecologist to follow you during this journey, but do not be on medicine prior to trying to get pregnant. But the obstetrician, OBGYN, they do have medications that can help you get pregnant. So absolutely, you can get pregnant. Nothing wrong with that. What will my life be like? That's the other question, people. Having extra hair in women always makes people look, as I had said, they look at you weird, not out of anything else, not because they know what's going on. They just don't know. And that's why you get the stares and stuff. So if you're self-conscious, this can distress you when somebody's looking at you and wondering what's going on. That can distress you. So it does happen. You'll find people looking at you. They don't know. So just let them be. None of the treatments actually makes the hair go completely away. It reduces the rate at which it grows, but doesn't completely take it away. This was surprising because some people have laser hair removal and never get hair again, but they just reduce they slow the growth, pretty much is what it is. They slow the growth. It will help to decrease also the amount of hair. So it slows growth pretty much and helps decrease the amount of hair. So that's basically what it is. Most people eventually feel better about their appearance after that hair decreases in growth. So if you want to do the laser, the electrolysis, go for it. If you can handle the pain, absolutely. If it makes you feel better, go for it. Life is short. Do what makes you happy. If you're not happy with the results of the treatment, then you can ask your doctor about other options. But basically, that's what overgrowth, excess hair growth in women does, and it's called hirsutism, but that's another name for it, is excess hair growth in women. All right, guys, I hope you guys are having a great week. We'll see you with the next topic. Bye bye.